Hey ladies, Miss Tammy, I'm back. I'm back first of all to go ahead and just thank you ladies for this morning, but I want to come back to my live because I did have a topic for today. That was just something that just got in the way. The devil just kind of tried to railroad what it is that I wanted to talk about today on our live. And I just wanted to get back and say we're back. Thank you guys again for just being a platform for me. But I did have a topic that I wanted to talk about earlier this morning, so I decided I would wait till noon. Hey, girl, yeah, I'm good. I am so good. So we did get that other situation situated. She is situated now in a hotel room, and we do have staff already there. We had a prior commitment anyway, so it was a win-win. But what I wanted to talk about is varicose fat, okay? And a lot of women don't know really what that is. Some of us will come down to have surgery and see bulges and pulges in our stomach or think that we have enough fat to transfer. But some of us are running into problems where we have the type of fat that's not transferable. And it's the type of fat that has to either be lost by weight loss. It's a deeper fat than what the doctors can actually go to use to transfer. And sometimes we're unaware that we have that type of fat. And again, it's called varicose fat, and it is a fat that's not transferable. And so a lot of us come here. So again, a lot of the stuff we talk about so that we can do our research, if we're not sure if we have it or not, or if the fat that we're seeing or the bulge in our stomachs that we're seeing is that varicose fat, or is it scar tissue as well? Because a lot of us have to really, really be honest with ourselves. I did have a young lady that came and people were telling her that she just needed she just needed a 360 lipo. And I said to her, I said, is that your friend? Because what I'm seeing is a stomach big enough that you have to be honest with yourselves, ladies. Look at yourself. Don't have anybody else tell you stuff that you know, because right now we trying to either be cheap or we weak. Because this ain't for the weak and this ain't for the cheap. The weak mean we don't want to go through too much. We don't want to go through too much pain. We want to find an easy way out. Or we cheap and we don't want to do what we need to do. Okay? Because we don't want to pay for it. You see what you see. And if you're not sure what you see, I have a lot of people come in and say, I just going to get lipo, and you need a tummy tuck. Oh, I don't want the scar. And trust me, I've had 2 tummy tucks, and I've used Mederma. I use it like chapstick, and I have no scar. I show it to the ladies consistently. I've had, most of my children were born C-section. And so, of course, I have scar tissue and all of that. But I use the Mederma quite frequently. I use Mederma. I take my tape off. I'm just saying for me. I'm not saying for you, because I know us as black women, our scars are deep. And we scar, and we not somebody that can take some scar away or scar gel and use it after we've scarred. It's a harder process. So I tell people I use it while I'm healing, because it actually helps the scar disappear for me. So that's one of the things that's on my list for women to bring is Mederma. I live by it. Every surgery I've had, I've rubbed it on it. I don't have incisional scars. I've had girlfriends who've done things and hit their men in heads and stuff like that and used it. So again, I think y'all heard me talk about it before. Listen, it's better than anything. Bio oil, scar away, anything. Mederma. It's a little expensive, And again, it's same for the weak and it's same for the cheap. It's a little expensive to buy that small tube and continuous lose it because it's about $25 a tube. But I noticed lately it's not able to stay in the drugstores anymore. I don't know if y'all going and stealing it or what, but I noticed that it's actually starting to disappear off the shelves because it is wonderful with removing your scars. I do it while my scar is fresh. I use it along with an antibiotic ointment. What was the Neosporin or whatever, because girls say, what if I get an infection? And that ain't causing no infections or anything. It actually smooths your scar. I wasn't consistent with mine. Yeah. And just, being consistent, right? Because again, you have to dedicate time to this. Time to your healing process, right? Watching yourself change every day. Just like you were consistent with taking your vitamins and your iron and shit to get the surgery, you got to be just as consistent after the surgery with what you're doing to maintain what you've done. Again, proper planning prevents poor performance. You guys hear me say that quite frequently. Instead of we're checking about what the doctor BMI requirements is, find out what the requirements of your body is. Find out if you are a candidate that has visceral fat, a fat that's not transferred. Is most of the things that you're seeing, is it transferable? Do I need to really get a tummy tuck versus lipo 360? Because lipo 360 really depends also on the doctor, you guys, how aggressive that doctor is going to be with that lipo. Okay, and some doctors are more aggressive than others. And if you really are thinking of only getting 360 and you really thinking to yourself, because we know what we know. Like I know I really should get a tummy tuck, but I really don't want it. So I'm going to go ahead and try this because that's what you're doing. I'm going to go ahead and try the 360. So again, that was a topic that we were discussing last night. So I had to make sure that education is very important. But we have to also just have a platform to have us think differently, right? Are we really researching? Are we really preparing ourselves the best? Are we in the best position that we can be in? And sometimes that's about having somebody say something that makes you rethink a thought, make you really think about what it is that I'm doing to prepare for this and really be prepared for afterwards, right? Because it don't stop after the surgery, after you leave Miami. It doesn't stop there. What are you doing back home? Have you prepared yourself for when I get back home? Am I doing? That's where most of the surgeries fail. Everybody's on board. You're all gung-ho. You got the momentum. And then you get home and what changes? What changes? Why do I stop? Why do I get lazy? Or why do I compromise? Why do I say, oh, I see, you're seeing some results and now you're happy with just half measures because you haven't really seen total results until you really reach 3 months. I'd say efficiently that at 3 months, you've really seen the majority of what you're going to see. And it depends on what you do within those 3 months of what you're going to see. So stay consistent in what you're doing. Keep doing what you're doing. Keep getting, some of you guys are getting too many massages. I'm going to say that. Massages ain't what's giving you results. If you just got hooked on them and you just like them, just keep doing them. Just waste your money. Because if you're doing it for results, or you're doing it because you make you feel good, then fine. But find out the reason that you're doing them. Because you don't really need to be doing that many massages. There are doctors that don't allow their people to do massages anyway. Yes, consistency is the key. Yeah, so consistency with anything rears results. The more you do it, the more you see it. But I just need to tell you guys, that isn't the case with massages. Okay? You can do reversal damage to your results by doing too many massages. You can begin to bruise your muscles. You can begin to sensitize your body. Like too many massages is not going to give you the results. Compression is the key too, by making sure that you're compressing. So really we don't need to do them. I'm not going to say that you don't need to do massages. I think when you're in Miami, the first few days that you're here, I think they're important to do, to start your lymphatic drainage system, because a lot of us have not really had this type of surgery. A lot of us aren't active. We're not, we're not really as healthy as we want to be. So our system is really kind of works against us. Some of us don't even know what the hell's going on with us until we started doing this surgery. So I think that, yeah, you do need to get a few to make sure that your body has activated your drainage system. But we already talked about that in one of my lives, on one of the best ways to activate your drainage system is when we use the infrared lamp, making your body secrete the fluids so that your body automatically recognizes that there's extra fluid and it kicks on. Because right now the fluid has been entered your body artificially by the lipo fluid, right? So your body didn't secrete that. So we get massages so that your body can recognize the fluid by moving things around and massaging it, and then your body system kick in and say, hey, okay, there's fluid. And then it kicks on, and then you know that it's really on because you're using the bathroom quite frequently. You're using the bathroom more than you thought you would have. You're drinking your fluids. You're using the bathroom. Every day you're seeing your body changing, so you know that it's working. But if you just feel it, and there's another way to find out that your lymphatic drainage system has kicked in. When you start seeing a lot of fluid in your face, you start looking like a fish. Your face is swelling up and all of this, and you're saying, oh my God, why my face is looking like this and stuff, and you're laying down and you're waking up and stuff. So when it does, it seems to suck the fluid and everything starts to. There's some girls that done that, and we say, hey, her drainage system is not on yet because the fluid is just moving around to different areas, and she's starting to feel bloated and stuff, and her face is real fluidy and stuff like that. That is definitely another sign that it's probably not kicked on. So the answer to one of the questions is, I'm not going to say that you don't need to do any of them. You just don't need to do a lot. A lot of the doctors say 10 is enough. They feel like safely that if you've done 10 lymphatic drainage massages correctly, that you possibly have activated your drainage system. That should be sufficient enough to activate your drainage system if they are done correctly. And that's without using the other types of machines that we talked about that we use, that if the massage therapist is performing the right technique, that 10 should be sufficient enough to say that it is active and it's open and you're actually draining and you're good. Now, people start talking about 25 and 30. I'm just saying, hey, you got money to burn. Go ahead, burn it, because you're not really doing yourself any service. I just think that we just have myths and we just hear stuff and just run with it. But so safely 10 would be the max. But I basically would tell women before they leave, like, hey, girl, you don't need to get any more massages. Don't let anybody open your drains. Just go ahead and self-massage. Get the massage roller, massaging, and yourself, while you're in the shower, and compress, and you're good. So, again, getting the right information, getting information that has been proven. A lot of us get theory, or a lot of us get people's fears or people's foes or people woes, and some of it just ain't. I think it's too aggressive. Like I said, I told somebody that you might be doing a little bit too much walking. When you have a tummy tuck, you got to be careful with walking too much, because that lower area will become inflamed and sore. So always more isn't better. Yeah, so I just wanted to come on and talk about the varicose fat and finding out whether or not that's the case, especially when you're looking at areas of your body and you might be thinking that, hey, I'm small, but I have this bulge. I wonder if I got enough fat. Before you go and they say, well, we don't see enough fat. I had a young lady who didn't have any fat on her body. She just didn't get correct massages, and the fat and the fluid hardened in her body because she was getting massages, but they wasn't done correctly. And what it did is her drainage system was never kicked on, and it kind of hardened within her body, and it made a bulge that made her think, well, possibly, I need lipo. And she came to Miami, and the matter of fact, it was Dr. Williams and Dr. Brewster basically told her, you need to get off you need to stay off plastic surgeon table. You don't have any fat. Matter of fact, when you went to DR, they took all your fat, even the good fat. And what has happened is the fat that has loosened and along with the fluid has hardened because you didn't get adequate lymphatic drainage massage. It's not adequate amount. It was that the technique was not correct. And it did not open her drainage system. So things just kind of sat around. And it hardened on her. So wood therapy and things like that is something that they suggest that she do to kind of loosen that back up and hopefully get all that loosened and start that process all over again. So again, thank you ladies for listening. So I just wanted to educate you guys on another thing to look out for when you guys are thinking about fat transfers, making sure that you have good fat to transfer. And I think that that's something that we don't think about or look about. We just think that we come down here and everything we see and take as much fat as you can. Take it all and put it where I needed to put it. But all can't be transferred for some of us. And then some of us come down and get disappointed because we, again, learn that we have more scar tissue than fat, that we're not going to be as flat as we want to. I'm also a candidate where I have most of my children C-section, and I had muscle failure. It was caused an incisional hernia where the insides open up, so I have what they call mesh to close up my stomach. So again, me too. I be like, man, why this thing ain't flat? They was like, Dr. Valina was the last doctor who said, you ain't got nothing there. That's muscle. That's muscle and scar tissue. And so stop trying to get lipo around muscle and scar tissue, and it ain't there, because everybody, I would like to be as flat as a lot of women, but unfortunately, my history tells me that I can't, and I've learned that, as I go across women in plastic surgery, you're going to meet 3 type of haters in this game. They're going to be the ones that, first of all, can't afford it. There's going to be the ones that can't get their BMI down to do it. And then there's going to be the ones that found out that they can't get it because they're unhealthy or they're not healthy enough or their health won't. And then you find those ones will downgrade plastic surgery, and I have some friends that say, well, why girls be bad mouthing, she got her body done, this, that. A lot of times it be them ones that want it done and can't. What is a good detox? They can't get it done, and then they speak badly about the surgery. I wish everybody well to get it done, but I want to inform you guys, before you get disappointed and can't get it done, make sure that you check everything. If you can, just pull up some of the lives that I've talked about and make a checklist off of some of the stuff that you have. I mean, the information's out here, right? So do your homework, go through and take something from each live, write it down, and give yourself a checklist, right? And that way it helps you know that you're on point with some of these things. I think that a good detox is, and I actually use it here to help women also move their bowels, is Trimax. It's TRIMMAXX. I think it's Trimax. It's actually on Amazon. It is a tea that is a detox. It's not as gripey, but what it does is it cleans your upper intestines. A lot of detox teas clean your lower intestines, but this one cleans upper intestines down, so it gives you a bigger flush. It actually works toward the upper area of your abdomen, and then it pushes everything through. A lot of the girls always go back and say, what was that tea, Miss Tim? I cleaned out totally. I didn't feel like I had to run to the bathroom, but it lets you know that you need to go. and you probably will go about 3 times, but you feel like you had a full bowel movement, not like you had a half one, not like, you just did a lot of water and things aren't there. But I will put a picture of it. Actually, I will not just give the name. I'll actually put a picture of it in on Instagram. You guys, so look for that coming of the Tremax tea that I actually use to help the girls also move their bowels afterwards, because it actually cleans the upper intestines, and it's very, very good. Tremax. And it's on, and it doesn't matter which flavor. I mean, I got yellow, orange, brown, green box. You get it on Amazon. I get the 3 boxes for like maybe $30. And I think there's like 80, 60, 80 tea bags in there. And I always give the girls, after the 3rd day of surgery, I'll give them a cup of tea with peppermint tea. So the Tremax with peppermint tea, because peppermint tea is good for bloating and inflammation, and peppermint is good for anybody that have irritable bowel syndrome. Peppermint helps that. So the Tremax with the peppermint tea and sometimes the nettle tea. I would sometimes do a cocktail of those teas, because the nettle tea helps with inflammation. You have your peppermint tea that helps with bloating and different things like that. And then the Tremax helps flush. Oh wow, somebody said they have IBS. I know, right? She just keep talking. She just keep giving her information. And so that they definitely, after that, they feeling up and vibrant, and they go and then the color in their face changes, because it's one thing about just being, I can't use the bathroom, we still do, the different, shakes and stuff like that. But then sometimes some women, even if you, like you say, you come to surgery and you already have bowel issues, or you might have IBS, and you have this surgery, that's going to be the number one thing that you will want to do, is try to get a bowel movement as soon as possible, because it definitely stops your process and how you feel and how you move and how you recover. It just really puts a Debbie Downer on your situation if in fact you have not had a bowel movement. So you definitely want to do that. So yeah, Tremax. Again, I'll put a picture on that, and so a lot of the women have kind of love it. So Tremax, nettle tea, and peppermint tea are, and then remember, because they were saying don't drink no teas before surgery. Girl, you can tea yourself to death after surgery. Just drink those little tea leaves, and they're very powerful. It's a very powerful combination when you do those 3. It gives you an overall sense of wellness. Your stomach isn't as bloated. You've had a bowel movement, and plus you're taking care of your hemo and your tiredness and stuff from low iron, possibly from surgery. But that's my time for today. I've been on 3 times today, girl. At the first 2, I had to take care of me. So now I come back for you to just talk about some topics that we normally talk about. I have put them together. Yes, I have put them all 3 together. I do give them all 3 together, but then they all have their individual. Okay, it depends on the need. They have their all individual things they can do, because I will give the nettle tea itself to someone who is having hemo issues, that their hemo has dropped after surgery. So at this point, I'm not trying to move their bowels or anything. I'm just basically trying to get their hemo up. Then we have some girls who come in and they're dealing also with nicotine issues, or also things like that, because also peppermint, rubbing peppermint oil and stuff like that help clean the lungs and stuff. So peppermint is good for irritable bowel syndrome, and also good for clearing your lungs, help with clearing your lungs out and everything. And so some people might say, Miss Tam, I might fail my nicotine test or something like that. And I'll say, hey, drink water, go to the gym, sweat it out, and drink some peppermint tea. Okay? And it just has a whole lot of other health factors to it. And then, of course, the Trimax itself is for cleaning out your bowels. But then there's sometimes where that girl just needs that extra push. I'll just give her all three at one time. And I'm telling you, though, that's some good tea. I have so many girls call me back. Miss Tammy, what is that tea you gave us? You know, girl, you just sit. Yeah, you just sit and drink that tea and you just got that. It just make you just cross your legs. Anyway, they're calling me. I got my surgery dolls down. I got a little time, but let me go get off the live, ladies. I'll put that. Okay, ladies, until next time, Miss T out. Am I my sister's keeper? Yes, I am. And remember, this ain't for the weak and this ain't for the cheap. Miss T out. Talk to you guys later.